Hello Team Phoenix and welcome to my YouTube channel. My name is Catherine Maina. Please call me Kate Mimi. I'm a United Kingdom registered nurse as well as a Kenya registered nephrology nurse. So this YouTube channel is meant to educate you, to educate somebody else, everybody. We need people who are empowered in their own health. It is all about non-communicable diseases, communicable diseases, nursing matters and healthcare matters. That is the essence of this YouTube channel. So tune in and let's learn together. Signs and symptoms of kidney disease is actually weight loss and poor appetite. When I say this, it is because remember when we discuss about the functions of the kidneys, we talked about toxins removal, we talked about urea specifically. Now what happens is that when we have too much urea in the body, you're not able to, your gut, that is your stomach, your intestines, they are not able to work as they should, and so you start feeling this feeling of getting sick, like you want to get sick. That is what we call nausea, and then sometimes you might even vomit, and with this you're not able to eat properly. Your appetite just declines. You will notice that that is also a sign and symptom probably of other diseases. So that is not the only criteria that we are going to use. The other thing is that we have body swelling. You might swell around the ankles, around your ankles you might swell, around your shin, around your wrists, and under the eyes you might start swelling. And these are signs that you're retaining water. Remember, I will keep on taking you back to the functions of the kidneys. Water removal is one of the functions of the kidney. So if the kidneys are not removing water, that water is going to go into our tissues. And one of the places that is going to settle is around the wrist, the shin, the ankles, just we have talked about. And sometimes the lower back when it is so advanced. That is just the, right here, just behind your back. I don't know. Yeah, it's called the sacrum. The sacrum, just under your lower back. That is where some fluid is going to settle. Another one is shortness of breath. This is closely related to the fact that your kidneys are supposed to be removing water, and this water, besides settling around the places that we can see, it goes to the lung tissue, okay? And you will present with shortness of breath. Why? Because the lungs should not have any water in them, okay? It is simply for gaseous exchange. That is, we breathe in oxygen, we take out carbon dioxide, okay? We breathe in oxygen, we take out carbon dioxide. But then again, when we have water, this water is just going to reduce the surface area that gaseous exchange is supposed to happen. So what this will happen is that you will not have enough room for air exchange to happen in your lungs, and then you will start feeling shortness of breath. Now for some people it might not be so dramatic. For some people it is like, initially you could take the stairs and then you can't. Initially you could lie flat and then you can't. Initially you used to use one pillow when you sleep, and then suddenly you need two. Perhaps you need even more, so that you can prop up your chest so that you're able to breathe. These are things that you need to take note of. They are not normal. And I have to say this especially to our parents and our grandparents back at home. It is not normal for you to use several pillows for you to be able to sleep. There is a problem. We need to address it. Okay. Tiredness. You will come and tell us that you're very tired. We call it general body malaise or just fatigue. You're constantly tired. The things that you used to do, you suddenly can't do them. You're feeling low of energy. You're feeling that it is taking too much energy even to walk from here probably to the kiosk. You're feeling that this is just too much. Now remember, last time when we talked about functions of the kidney, one of the functions was actually erythropoietin production. I said that this is a hormone that is produced by our kidneys to help our bone marrow to process or to manufacture the red blood cells. So one sign of low blood in your body, we call it hemoglobin, right? It is actually anemia, and anemia will present with tiredness. Does it make sense? Does it match now? I really hope it does. At least to me it does. I really hope it does to you. So anemia, and it will present with tiredness. So you'll tell us, you know what, I'm just tired all the time. And interestingly, this is the only reason people will come to the hospital. And so many times as healthcare providers, we actually miss this one out. We think, It could be common things like malaria, probably in my region in Kenya, because it's quite common. We will think about things like diarrhea diseases. We'll talk about and now in the era of COVID, we will think about COVID related symptoms, isn't it? But then again, it behoves us to take an extra mile, investigate and find out where is this tiredness coming from. And to the all healthcare providers out there, if you've been treating somebody for anemia and you really do not know the reason, probably you need to investigate the kidneys. You need to look at the kidneys. How are the kidneys? That's something that you need to think about. If this patient is always coming to you with anemia, so where is it coming from? You've looked for infestations. There is nothing like that. The person deworms regularly, so you can't say that it is because of minyo. That is parasitic worms that are causing it. Their bone marrows are fine. And then the other reason, they are not bleeding, they are not having any stomach issues. So you want to think about the kidneys. I really want to emphasize that to all healthcare providers. Make it a routine to check the kidneys, especially when patients come with tiredness. The other one is actually urine changes, and this is why I keep insisting that make it a habit to check out your urine. You need to know how normal is your urine, how does it look like water time. So you will notice that with chronic kidney disease, your urine production might actually reduce drastically. Well, not drastically, actually, it is gradually. That's the one that I'm looking for. Urine production will go down. So where you were able to pass urine for about 2 liters in a day, you will find that you're passing just a wee bit amount of urine. And it is so sad that so many people undergo this and they think that it is normal. And that is why I'm here to tell you what is actually normal and what is not normal. And passing just a wee bit amount of urine when you're drinking enough and you're eating enough, it's not normal. Even when you've not drank water, you're supposed to pee. Let me explain. In each and every time that we are taking food or normal body processes are going on, there is always some water that is being produced. So yes, the urine that you produce will be quite concentrated, but you should be able to produce urine, okay? So when you're not producing urine or the amount has gradually declined, you want to check your kidney functions. And this is one of the reasons you need to pay attention. For some people though, I have to insist, your urine production actually becomes more. Please hear me out. For some people, where you are not waking up at night to go pee, suddenly you need to wake up so many times and you have bothersome sleep because the bladder won't let you rest. You just have to go and pee. So these are two aspects of urine changes that I want you to know, that for some people urine will decline, the production of urine, and for some people it will actually be too much, and especially when they want to sleep, okay? The other thing that I want you to know is that besides that, there might be blood in urine. You will notice blood, or sometimes you'll just notice the color of urine has changed. Now, blood is not so common to see frank blood in urine. Do you think about soda, Coke, okay? Think about Coke. Your urine will start turning the color of Coke. That is actually broken down red blood cells that are passing through your already damaged kidneys. Does it make sense? Please look at the color of urine. It looks like straw colored urine. That's normal. And when you've drank a lot of water, it's supposed to be clear, okay? But then again, when you're having blood in urine, it becomes the color of Coke. Yeah, it starts looking Coke-like. We call it cola-colored urine. There might be proteins in urine. Now, you will not see proteins with your naked eye, but the urine might start becoming foamy, okay? Think about when you're washing clothes with a lot of soap, okay? So there's that foam. Your urine will become foamy, or what you call frothy. So that means that we have some proteins in urine. And by the way, when it is getting to the level of having that color of Coke, to mean there's blood in urine, or even forming foam to mean that there is proteins in urine, manze, you need the doctor. Like really, the disease is quite advanced, or probably there are other causes of the kidney damage like acute nephrotic syndrome, things that we are going to be talking about on this channel. So those are some of the things that you need to realize. The other one is insomnia. Insomnia is lack of sleep at night. I know people on Facebook are always like, oh my gosh, insomnia, what do people do when they can't sleep? No, in kidney disease it is serious. It is not because you've been staring at your screen for ages and then you miraculously expect your brain to fall asleep. No, you have been overstimulating your brain, and that is why you cannot sleep. Okay, everybody on social media, you need to put your phone down, you need to put your computer, to shut down your screen, stop stimulating your brain too much and allow it to fall asleep naturally. You are going to be able to sleep. Okay, but then again, in kidney disease, in chronic kidney disease especially, the patient finds it hard to fall asleep. And it is so severe, it's so bad. They try everything, they try meditation, they try everything that they are being told, and they just can't fall asleep. Now, if you cannot sleep at night, it means that you will be extremely tired during the day. So this is actually quite tricky, because when you come to the hospital, you're going to tell me, nurse, I have a problem, I can't sleep at night, and that is why I'm so tired. Do you have something to help me sleep? Does it make sense? So you will think that your problem is actually because you cannot sleep, and that is why you think you're so tired during the day. But the issue here is you cannot sleep because there is an underlying problem, which is chronic kidney disease. And that is why I'm going to encourage all healthcare providers out there, allow me to hammer it to you. Think kidneys when patients present with these non-specific symptoms or generalized symptoms. I want you to think about kidneys. Kidneys, 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 kidneys. And itchy skin. Do you remember? Oh, you might not. See, on Wednesday, I wrote on my blog, that is www.katemimi.com. I'll include it in the description below. I wrote about the relationship between the kidneys and the skin. So I told a story whereby I was a student nurse in this surgical ward, where a patient was actually going for theatre, but he couldn't move away from the nursing station. He kept saying, "Daktari, I cannot stop scratching my skin." So he kept on scratching all the time. And I remember I was just a first year student nurse, and the nurse who I was with was actually quite irritated, because you can imagine a ward of 50 plus patients, and you have one person who is always telling you, I cannot stop scratching my skin, and you have given them antihistamines and everything that they need that has been prescribed, but they just keep on telling you that they can't stop itching. So I told that story, and what happened is that this patient had not been reviewed by the anesthetist, and when the anesthetist came, the patient said, you know what, I cannot stop itching, and this is my problem, I am itching too much. So it turns out kidney function test had not been done. I bless the name of the Lord because of that anesthetist. She was able to request for them for the kidney functions test, and believe you me, the kidneys of this patient were shutting down, and she did everything that she could, and we referred the patient to Kenya's biggest referral hospital, where dialysis was taking place back then when I was still a student. So these are some of the things that when I was in class, or when I was reading more about kidney disease, I remembered this patient that the only problem that he was complaining about is itching. So healthcare providers out there, I know some of my audience, my patients, my clients, and people all over the world who are watching this, itching can be a sign of chronic kidney disease. Investigate the itch. That's what I'll say. As long as it's not an allergy, you've not eaten anything that has, or maybe something has, has crawled on your skin and then you're reacting to it. An intractable itch, that is an itch that has not responded to regular medication that your doctor has given you. These are things that you need to investigate kidney disease. Now look, Team Phoenix, I tell you these things because I consider you people, especially people who do not have medical knowledge, as partners in health. Where a doctor or a nurse may forget things, I want you to remember them at the back of your mind. I want you to propose. I'm not telling you to bulldoze your way, but I'm asking you to propose things to your doctor. You have an itch for years, you have an itch for months now, an itch that was not there. Probably you've started noticing skin changes. Perhaps there are some white patches on the skin that you cannot understand. Recommend kidney function test to your doctor. It doesn't hurt to say things, really. As long as you say them in a nice way, it does not hurt. And any doctor worth their salt, any healthcare provider worth their salt, they'll be happy to know that you know something about your own body. These are things that you're just proposing. And you never know. Just have a wee look at and the kidneys. The other thing is muscle cramps. Now again, when we discussed when we discussed functions of the kidneys, I did say that one of the function is actually salts regulation, and I call these salts electrolytes. Now, we discussed potassium, calcium, phosphorus, magnesium, and others. So when we have a problem with calcium regulation, potassium regulation, you will present with muscle cramps. Believe you me, you start having muscle cramps, and some are so bad that you cannot even walk. Some are so bad that they attack your back. Interesting. Probably I've had a couple of muscle cramps in my life, and they were on my feet, okay, which is normal sometimes, and I was able to exercise and move them, and they were able to disappear. But then again, muscle cramps that are caused by kidney disease are severe. They are painful, they're quite horrendous, and they keep on attacking you regularly. So if you've been having cramps that you do not understand where they are coming from, perhaps it is time we look at your kidneys. And some also affect our stomach, abdominal cramps, and these cramps attack your abdominal muscle, and they are quite uncomfortable, they are quite severe. Headaches is another sign, is another symptom. Yeah, symptom is what you can say. That one function of our kidneys is blood pressure control. So if we're having a problem with our kidneys, the blood pressure is going to be elevated, and if we elevate the blood pressure, that is, the blood pressure goes up, one sign will be headache. You had your migraines, perhaps. We need to look at your kidneys as well. Okay, makes sense? Thank you very much. The other one is erectile dysfunction in men. Allow me to dwell on this a wee bit. Lately, we've had so many deaths in Kenya of men when they are having sex, and we have been told, if at all the media reports are anything to go by, that they had taken the blue pill, okay, the little blue pill, to enhance their sexual virility, their stamina. Now, if you're a man out there and you've been having erectile dysfunction, I want you to know that one cause is actually kidney disease. The other cause, a very common cause, gentlemen, is diabetes. Please, before you go to buy the little blue pill, can we have a wee check at your blood sugar level? Can we have a wee check at your kidneys? Don't go for blue pills. Please think about your kidneys. Think about diabetes. Please investigate. You never know, okay? So besides all the other causes of erectile dysfunction, can we rule out kidney disease? And can we rule out diabetes? Okay? Thank you. So that will be it for now, really. Because it is important for you to understand these things. It is important to understand how kidney disease presents. And I will keep on insisting that you will not understand how kidney disease presents or why it presents the way it does until you understand the functions of the kidney. So you will notice that all these signs and symptoms that I have talked about actually overlap with so many other diseases and illnesses. So it is up to you to go to the hospital and have the doctor or the healthcare provider, who is your primary healthcare provider, to check more about kidneys. I am insisting on this because it is so sad that we keep on having people report to our units when they are in end-stage kidney disease, that is stage 5. Remember, we did say that kidneys fail progressively over a couple of months or years. So if we are able to detect it early, we can slow the progression to failure very early. There are so many things we can do in stage 1, in stage 2, in stage 3, and in stage 4 to some extent, which can at least help us to make sure that we slow down the progression of the kidney disease. So thank you very much for watching. I can't wait to have another video, and then we can talk about these stages that I'm talking about. I'm just touching on them a wee bit, and then we're going to know what is stage 1, stage 2, stage 3, 4, and 5. We're going to talk about all those things in our next video. So in the meantime, I am grateful for your time. I'm happy that you've seeing that it is important for you to listen to me, please, I will be happy should you subscribe. Please subscribe because you're amazing. And then like this video, share it among your buddies, and then follow me on my blog, that is www.katemimi.com. I will include a description below. So thank you very much, asanteni sana, and see you next time.